Well, we've just wrapped up February, which is Heart Health Month, but frankly, every month ought to be, since heart disease is the #1 killer of Americans. We recently sat down with Melanie Denon of Las Vegas Fire and Rescue to find out some things we can do to avoid heart disease. She also talked about learning CPR and why that's so important, because saving any life is incredible, but you could save the life of someone you love. When someone suffers a heart attack, time is of the essence. Every second that passes could be the difference in life or death. That is why, if you or someone you are with thinks they're having a heart attack, the first and most important thing you need to do is call 911. This not only gets the patient to the hospital quickly, it starts the vitally important treatment immediately.
We can look and see if you're having a heart attack. And if it looks like you are, even if it looks like you're not, but you're exhibiting the signs and symptoms, we have medications to treat that. Pain medication, nitroglycerin that opens up your blood vessels and tries to get blood flow around the blockage. Same thing with a stroke. You know, it's easier for us to get through traffic with lights and sirens than, it could take you 30 minutes to get to the hospital, where we can get there in half the time. We do a lot of the same treatment besides surgery that they're going to do in the emergency room anyways. We are a mobile emergency room. That's why we're there. That's why you want to call us.
The second most important thing you can do is join the mere 3% of the population that is trained in CPR. Denon says the American Heart Association has done numerous studies and found it's not as intimidating as it used to be.
And they found that the majority of people were not doing CPR because they had to do, you did mouth to mouth. And unfortunately, when somebody goes into cardiac arrest, sometimes they vomit or they have fluid in their mouth, and it could be a stranger. And so they found that the breathing is not as important as we used to think. Now it's just keeping that blood flowing until emergency crews can arrive and oxygenate it.
She demonstrates the simple yet life-saving steps. First, check to see if they are conscious, breathing, and have a pulse.
If they're not breathing and there is no pulse, you want to start CPR. You want to follow their rib cage up to the very top. Put 2 fingers there, and then right above that you put the palm of your hand, okay? The base of your hand, the heel of your hand. 2 hands, you want to get right above them so your shoulders are directly above them and you're not pushing sideways. And then you want to just push down hard and fast, about 100 to 120 beats a minute, to the rhythm of Staying Alive from the Bee Gees. About 2 inches.
Now, no matter how strong you are, continuing this pumping is exhausting, which is just one more reason it is important more people get the training.
Do it until you just can't anymore, or until if somebody else comes who knows CPR, you want to switch every 2 minutes.
Of course, the best thing we can do is to prevent heart disease, but that takes work. Denon says start by exercising. Now, you don't have to become a triathlete. Just get up and move. Utilize our great city parks and trails to walk, jog, or ride a bike. If you smoke, quit. If you drink, do so conservatively. And diet is key. Try cooking at home more, but watch what you prepare.
You should always add color to every meal. Any color of the rainbow you can fit in there, fruits, vegetables, all of it. Cut down on fatty meats, go for lean meats. Avocados are great. It's actually a really healthy fat. And fatty fish has good omega-3s for your heart.
Finally, know the signs of a heart attack and do not ignore them or hope they just go away.
Common symptoms are going to be chest pain or pressure, usually in the center of your chest. Men and women do present differently, though. So that's one thing people need to understand. Men can get shoulder and jaw pain, like on one side of your jaw or your neck. Women tend to they'll get chest pain, shortness of breath, lightheaded, and nausea, and pain in your back, right between your shoulder blades.
Leading a healthy lifestyle, knowing the signs of a heart attack, and Denon strongly adds knowing CPR can make the difference in saving a life or someone passing.
70% of cardiac arrests outside the hospital happen at home. So learning CPR, only 3% of our country learns CPR. So people need to be part of the 3%. And you're more likely to do CPR on somebody you know or love.
Melanie says Las Vegas Fire and Rescue is working on giving regular CPR classes, but you can find them just about anywhere. The Red Cross, American Heart Association, just go look online. Now, at these CPR classes, you'll also learn how to operate an AED. You see these boxes all over the place. Las Vegas city parks, big box stores, the airport. It's another important tool in saving lives. But Melanie says even if you don't have that training, the machine literally walks you through the process and you can save a life.